I'm Julia McCarthy. I'm a senior program officer with the NYHealth Foundation. And before we get started, I'll just go over a few housekeeping items. First is that we'll be recording this webinar, and there'll be a recap with the link to the recording, the report, and other materials that will circulate probably tomorrow or the day after. We have video and audio disabled for attendees, but we would ask that you please use the chat box throughout the event to share questions, and you could even start now. There's also closed captioning that's available for those of you who'd like to use that feature, and I believe you can click to find it in the top right corner of Zoom. Turning now today to the topic at hand, and that's expanding access to food for foreign-born New Yorkers. As we all know, food affordability is an especially urgent challenge for many low-income foreign-born New Yorkers. The high cost of food has dominated media headlines in recent years, and politicians at the federal, the state, and the city levels are increasingly discussing the issue of food affordability for Americans across the board. But in New York, in the city of immigrants, many are still ineligible for public benefits or cannot afford the food they need. And recent federal cuts have left more than 40,000 refugees and asylees without food assistance that they previously had. Luckily, New York City has a long history of stepping up to meet residents' needs when the federal government has stepped back. And so here to discuss those steps today, the steps that New York City is taking to preserve immigrant food access, are three experts. I'm going to turn it to them first. So it's Kate, Carmita, and Adama, and they're going to discuss current needs, best practices, and potential places for additional investment. So again, quick round of self-introductions. Carmita, I'll start with you.
Thank you. Good morning. Good afternoon, everybody. I'm Carmita Padilla, and I'm the Executive Director for the Harlem Bureau of Neighborhood Health. We're part of the Center for Health Equity and Community Wellness in the Department of Health, where we're working in the community with the community to address the different health inequities that have happened because of the historic disinvestment that have been in these communities. So glad to be here. Kate.
Thanks so much, Carmita. Hello, everyone. Kate MacKenzie, Executive Director of the Mayor's Office of Food Policy. Thank you, Julia, and to the NYHealth Foundation for convening this really important conversation. I'm really excited to talk about this essential topic. Also, the great report that Carmita you pulled together, and Adama. Also, just the really rich contributions that you'll make today, and also just thank you to the participants and the people that have made the time out of your day, and for the questions that you'll ask and we'll discuss today.
Thanks, and Adama, to you.
Hi everyone, Adama, Executive Director of Afrikana. We run food pantries all across the city, but our main location is the Bronx and Harlem. And the conversation that I bring to food justice work is the exclusion of Black immigrants and Black Muslims, especially when we talk about halal food. Halal food is looked at as an ethnic thing when it's supposed to be a religious thing. And so it erases a lot of our communities. And I think when we talk about also food pantry, we also have to say that the times have changed, our communities have changed. Here in East Harlem, the folks that are mainly in our food pantry are not from the Latinx community. They are from the Asian community, the African community, the South Asian community. So times are changing and the need hasn't changed. The need is increasing. So thank you for the health department for having us, and thank you everyone for listening in.
Thanks for being here. So Kate, I'm going to start with you today. Can you help us to understand the policy decisions that have led to this moment? Why is it that low-income foreign-born New Yorkers may struggle to access food? And how are recent sweeping federal cuts likely to make food access even more challenging for foreign-born New Yorkers?
Sure. Thank you, Julia, for that question. You know, people from all over the globe come to New York City with a dream of building their life here. Many arrive with little more than that dream. And our administration is through and through committed to helping all New Yorkers make that dream a reality by making this a safe and affordable place for everyone to live and thrive. Too often, though, our neighbors find themselves in the same predicament that really so many New Yorkers face. High prices at grocery stores, high housing prices, exorbitant childcare expenses, and without enough income, whether that's from unstable hours at work or inadequate pay to cover the many, many costs of living that we're all faced with. For decades, SNAP has provided a safety net for families. However, some immigrants are ineligible for this program. or they're worried that applying for SNAP or any other benefit will threaten their immigration status, or they may not know whether they qualify due to language barriers or a real distrust of government services. And that lack of trust is not unwarranted given these truly challenging times. Even though SNAP benefits barely, if at all, cover the cost of groceries, the federal government is actively cutting back the program. Many of us know that last fall, H.R. 1 removed eligibility for refugees and asylum seekers, impacting about 15,000 people here in New York City. It also enacted new, stricter work requirements that went into effect in March. We've all become very familiar with this acronym, ABODs, or it stands for Able-Bodied Adults Without Dependents, that must work or participate in qualifying activities such as volunteering for at least 80 hours a month to continue receiving benefits. The cuts were unprecedented in their scope. SNAP participation nationwide fell by more than 3.5 million people, which is about 9%, between the law's July 2025 enactment, roughly a year ago, and February of 2026. H.R. 1, which is important to note, also eliminated federal funding for the essential plan of health insurance for most categories of immigrants other than green card holders, which prompted New York State to seek savings by eliminating essential plan eligibility for households at 200 to 250% of the federal poverty level. As a result, about 200,000 New York City residents are going to lose that essential plan coverage effective July 1st. And that essential plan covers food benefits, as well as obviously the benefits of health insurance, which are connected to food security. If these cuts were not enough, were not creating enough of a crisis, the emergency food system, Adama, that you were speaking about and that you do so much to support, is also being hurt. Federal funding was cut from food pantries at a time when demand is surging and stretching their food supply that's already so thin. And with the threat of ICE hanging over New York City, so many New Yorkers just don't feel safe going to food pantries. New York City has risen, as you mentioned, Julia, to meet our residents' needs time and time again during the pandemic, during the influx of migrants and asylum seekers. And we remain committed to making sure that every New Yorker, regardless of that immigration status, feels safe in this city and has the resources they need to access fresh and nutritious food. But however, with these funding cuts and supports to the programs like SNAP and these other life-saving benefits, we're really going to need to continue to be super creative in how we are able to keep New Yorkers safe and healthy. But that's just a little bit of the background context, as you mentioned, for why some of these conditions exist to start with.
Thanks so much, Kate. That's, pretty sobering. Adam, I want to turn to you. So you're a frontline provider, and so you have direct insight into how these cuts that Kate described are affecting New Yorkers, especially Black immigrant New Yorkers. And I was hoping that you could tell us a little bit more about how people are experiencing these policy changes on the ground.
Yeah, thank you. I think with these policies that are coming, they're also confusing for the people who are providing the work. Understanding all the details and what changes are happening. This is a new administration that things are changing every single day. And it's really hard to keep up if you're doing direct services. Our food pantry, we get our food for free. We don't rely on any funding for it. But it affects us when the provider doesn't have enough food. And one of the biggest challenges that we have is language access. All the pantry information that we have seen are in Bengali, they're in Spanish, you have Mandarin and Cantonese, but none of them are focused towards the Black community. And so they don't know how to access the food that we get. So we rely heavily on social media to make sure and advertise to our community that you can go to this food pantry. You do not have to worry about your immigration status. You do not have to have your ID, but you do need to give us your number. And unfortunately, how the system is set up is if I don't collect your number, I can't prove that I'm serving the community. For us, we aren't seeing an impact really with immigrants afraid of being on the line because they're taking a risk. It's a risk that they have to take because they have to feed their family. The other challenge that we found is the time of food pantries they don't work for the families that we serve. The only food pantry that we're able to pivot is Fridays, which we're able to push it to later in the evenings. So the families that work from the 9 to 5 jobs are able to come by and get their food. But many food pantries close after 5 p.m. So how does your community access food? In a perfect world, I would love to have a 5 to 10 food pantry where you can just drop in because you were working. And then the number of so for our food pantry, everyone that's on the line, I know their stories. I know who has diabetes. I know who is this diagnosed with cancer. I know who's raising their grandchildren or are facing eviction. So it just doesn't become just a food pantry. It also becomes a real impact of how do you support your community far beyond just food pantry. But one of the things that we've also been saying is like, how can we support you if it's not just food pantry? Can you qualify for public benefits? Our seniors, they stand online for hours and we feel sorry for them, but we don't have another solution. So for us, it's a very difficult time to be in, but I think we're in a very good administration that understands that because for a long time, we've never had an administration that understood the concerns that we're facing. Because being on the ground and working with people who can change policy, it helps a lot. So I'm grateful for that.
I don't know, just to be clear, you mean at the city level, right?
At the city level,
Yeah.
not at the federal level, at the city level.
Can I ask you a little bit more about, you started off by saying that like as a provider, it's incredibly tough to sort of keep up with the changes that are coming. And I think so often in this work, we are thinking about the individuals who are accessing food, but the providers and like provider safety, provider sanity, providers are tired. And so keeping up is really hard. And it's important to really focus on that as well. So could you talk a little bit more about like how that's affected you or people in your organization?
Oh, yeah. I think especially with the immigration changes, a lot of before with immigration, you were all automatically work permit was renewed. Now we're seeing people after 1 year, their work permit stops. And those are the folks that are at our food pantry because they're unable to find work again. They lost their jobs. And so with the changes, I really have to make phone calls around here like, hey, can you explain this? What is going on? What's happening on this policy level? So for me, it's help. I'm Adama. I'm able to make a phone call to legal aid and NYLAG and say, hey, we're seeing this, what's going on? And they're able to share that information. But it is a lot of work just to make that phone call and try to understand the changes and then try to share it with my team and like, oh no, they can't qualify for this because there's this new immigration policy. And really, the documents that are coming out from the federal government is not one piece of paper. It's like a whole booklet, or they're sending you big PDFs and you're trying to understand. And it's really hard because you really want to focus on the work and not trying to figure out what this memo that they just brought down in. And so even with the memos that are happening, they're telling you, okay, it doesn't apply now, it applies next month or applies from a year from now. One of the interesting things that the governor did is a program where they can place you in the food pantries to volunteer to make up for your hours. But the challenge is the people that are coming to volunteer with us is a risk for us because you're in a wheelchair, you have schizophrenia, you have diabetes, you have to eat a certain time. So it's a great program, but it's a huge liability for a small organization like myself who can't cover the insurance if something happens. If we do get sued from the person, what happens? But at the same time, it's a way for the person to keep their benefits by just showing up at our food pantry and volunteering. But again, it's a huge liability.
I don't know, that's such an important point as the SNAP work requirements go into effect, like thinking about how we keep organizations who want people to stay uh, connected to benefits safe as well. And I hadn't thought about it from that perspective. So thanks so much for mentioning that. Um, it's so challenging right now. I am heartened though, and you've talked a little bit about this, and then as did Kate, that the city has been taking steps to think about like how we may structure programs that can meet immigrants' food needs. And so I'm going to turn to Carmita now. Um, Carmita, you recently published a report that demonstrates how local programs can meet needs. And obviously, they can't fill the cuts that have been left by the federal government. And city programs shouldn't do that, frankly. Like we pay federal taxes to have programs as a robust safety net. Um, what I think your report does an excellent job of is demonstrating that there are models that can work in New York City and they can be scaled. And so I'd love for you just to walk the audience through some of your findings. You know, what programs did you look at? What was their reach? What were they doing well?
Thank you, Julia. Thank you again, Julia and the New York Health Foundation. You guys are really funding this report for us was so important, so we can do that. And when we discussed doing this with you, it was in preparation for this. We understood things were coming down because of the administration. So how do we put together some of the learn from the programs that are existing so that we can continue supporting our community? So this is what this report does. I'm going to share my screen out. So if you guys give me a sec. So I'm going to talk through some stuff, but there's just some information that you'll see on the screen. Second. All right, can you? Oh, hold on. All right, can you see that?
Perfect.
Great, thank you. Look at that. We learned. All right, so just to start, we looked at programs. There's 3 programs here in the city that have been that are specifically for this community, for immigrants that don't have access to the safety net programs. The 3 programs that you'll see right here is all 3 were initiated for different reasons. So you'll see East Harlem Food Voucher was initiated because learning from our community here in East Harlem that the foreign-born long-term residents in the community are the hardest hit with food insecurity. They have a harder term of food insecurity. Groceries to Go started because of during COVID. They were looking to expand food access during COVID. And the immediate response card program, they started because of the large number of immigrants that we were receiving and asylum seekers that were coming into New York City a couple of years ago. So they were initiated for different reasons, which means they have different components of design. And we wanted to look at that and see how were they designed so that we can understand how can we either expand these programs or look at the different components that might help us as we continue to serve serve the whole community here of how do we create solutions for this? So how do we create solutions for Adama, for your population? You're saying, right, at times we think of East Harlem as a Latinx, but no, it's also Africans, right? So how do we look at the different community, the different needs, learn from these components to be able to do that? So these are the 3 different programs that we looked at. You'll see just a brief overview of the programs. You'll have some more information here, but specifically, the East Harlem program was more of a local-based program. It was a limited time for individuals. It was paper vouchers that were being distributed every 2 weeks, and you'll see the benefit amounts there. Groceries to Go is a citywide program, and it was made for individuals that are part of NYC Cares and that are either have hypertension or diabetes and food insecure. They actually receive credits for their Mercado accounts that allows them to do grocery shopping throughout the city, various over 300 grocery stores around the city, and you'll see the benefits there also. Just as a side note, NYC Cares, if someone doesn't know, is a health and hospitals program that provides health care at low or no cost for those individuals that don't qualify for insurance. And then the immediate response card, you'll see that was made, as we said, as an emergency program for individuals that were here, asylum seekers. And they get a prepaid debit card that they will receive for 28 days while they were in the hotel voucher program of the city. So the benefit amounts differ because one is the food voucher program and groceries to go was the goal was to do supplemental services for food, while the allowances for on the immediate response card was more because they were looking to cover all food costs plus the essential baby supplies. So we were looking at that and how do we measure it? The outcomes that we had, and we think that's what these were 3 great programs to look at and look at the components, as you'll see, is they all had a great redemption rate. East Harlem Food Voucher had over 97%. At each cohort that we served, it was over 97% redemption rate. Groceries to Go, when we saw participants over 12 months receiving, they were able to redeem 85% on average. And then the immediate response card, I mean, that's amazing. 99.9% of the funding was used. And you can see the impacts of these programs. It is a food resource to help them with the food resource, but if you see the impact is beyond that, right? You look at the levels of financial stress, self-reported health. They're able to have a higher intake of healthy food, and it was on their choice because they had these programs allowed them to choose the food that they would buy, and then they would supply for their family. So through that, this is how they were able to not just improve their food insecurity, but all these other health benefits. In addition to the individual and the family support, also the local businesses gained from this. They had business coming in, and in East Harlem, we actually had great feedback from the grocery stores that we worked with, where they were not only happy for the additional business that they were making, but they also were feeling more connected to the community because of this program and participating in this program with us. Other benefits that we can talk about for the food voucher program was because it's a local paper-based where the participants come into our building to collect the vouchers. We had time to build relationships with them, to learn more about what they needed, how else can we support them. Really what Adama was talking about too. Like, you get to know the individuals and what their situation is and seeing how else can we help you, where else can we connect you to. Groceries to Go was, in addition to doing that food insecurity of that high need population, these immigrants with these chronic diseases, this also gave them a larger access geographically to other grocery stores. They can get grocery stores that are higher quality. If you have individuals that have mobility issues, they can get the food delivered. So it was providing all these other benefits. And then the immediate response card, this again, they had choice and dignity in what they were able to buy. So they weren't getting just shelf-stable meals. They were actually able to go and buy the meals, buy the food they wanted to buy, in addition to prepared foods, because a lot of these individuals staying in the hotels don't have kitchens, so they were able to buy prepared foods. So I think we're looking at this report, and we'll provide a link to the reports, and everybody can get it, and you'll see all the details. But the idea for us is to see is how these programs work here to serve a need, but it's not enough, right? So I think these programs can be expanded. These programs can be adapted within your organizations. And this report actually provides you that. It gives you the different components that you can learn from each one to say, how do I adapt this program to better fit my specific community? How do I take a piece of the food voucher program and maybe the groceries to go program? What are the components that I look at to do that? Our hope would be that you can expand the services you do with these learnings, but also think about, I'm not sure who's on, everybody that's here on this webinar, but also funding. How can you fund these existing? How can you advocate for funding for these programs that are going, so we can continue expanding these programs and also adapting them in other communities? So here's just a quick summary of how, if you just expand these programs, what they're well suited for. But I think the key for us was, how can you learn from here to build out more from your end? And we here as partners are here to work with you to see how we can expand it. We're really committed to doing this. And just kind of final considerations that I wanted to include, besides what these programs are and really pointing you to this report, is some of the initial considerations that we think as you're looking to implement this. And some of this fits really what Adama, what you were saying. But take the opportunity to build trust in these participants when you're working with them, especially at this time, Kate, as you said, with ICE and the fear that's happening. How do you build that relationship so they can come to your programs and be okay, be comfortable coming, getting the service, and also for you to be able to refer them to even more. Another thing is prepare for, we know the programs are in long term, right? Not everything can continue like SNAP. It's not a federal program that's set permanently. But so these programs do end at some point. How do you prepare them, the families, to that? We took the time in the East Harlem Food Voucher Program to talk about planning with the participants. In addition to providing them other resources, we would plan with them along the way. And also, I think, Adam, you hit on this, like, plan for the emotional support of the staff. The staff are dealing with listening to stories and really supporting these families that are going through really difficult situations. So the staff also needs the support and the emotional support, and plan support for that also. Thank you. I'll stop sharing.
Thanks, Carmita. I want to follow up on a couple things you said. I think first, we are in a political moment it's very different, right? It has created a lot of fear, as everyone has spoken about. But we also are in a political moment in the city where we can talk openly about these programs. Like even since the de Blasio administration, the mayor's office of food policy has been thinking about how to expand access to immigrants and doing so very quietly and slowly. And one of the we've talked a lot about this, but one of the privileges of being in a funding position is that that was something that we were able to say, like, the city's doing great work. Let's capture it. Let's talk about it. Let's elevate it. And so we are in a moment where we do have an administration that's not afraid, that is not going to shy away from the issue. And so that feels um, really important. I guess this is a tricky question then. So, but based on your findings, like what practices do you think could or should be scaled, and politically of the different models, like are there features that are easier to sell, I guess,
Yeah.
or easier to spread?
Yeah, I think if in many ways our programs are meeting the gap of SNAP because these individuals are not eligible for SNAP. So the big advocacy that we should be doing is SNAP has to be open for more, right? And it should be available for all. So rather than these programs that are coming in to fit this gap, how do we actually advocate at the city level, at the state level, maybe I won't go federally at the moment at this time, but at least city and state, let's do that. Let's get SNAP and we have the advocacy group SNAP for All, which is actually it. So how do we do that rather than all these band-aids that we're doing? But as we're advocating for that, we've got these programs that work well. They're showing that, right? Either a voucher or a credit card helps them and really look at the idea of like give the families the choice. They know what to buy. You don't have to put on any limitations or any expectations of this is all you do. We don't have to teach them anything. The issue is they don't have the money. So just give them the funds, either by, whichever way of these works, so they can go and buy the food that they need for their family. They can go prepare the food for their family. They will be healthier. They will eat healthier if we provide them. There was a lot of information from Groceries to Go and from Food Voucher where we can see what the families have purchased. And they're purchasing basic needs that when you go to a pantry, they can't get those items that are not allowed, but like oil to cook, like those basic needs. So I think the biggest thing for us to consider, I mean, you'll look at the report and there may be some operational things, but the biggest thing to me is give them the funding so they can choose and be able to provide for their family. And how we can, and you can look at it. Is it on a local level where you're looking to really know? And I think, Adam, I think that makes sense where you get to know your families. It's at a local level. You provide the paper voucher where they can use that more easily. Not everybody has a phone or technology. Here's the paper voucher. But look at your community. If your community has a technology, is able to buy online, provided that way, that gives you further reach. So I think there's various components that works for different community. Just stay focused on how do we get that funding to them directly.
And Carmita, I'd say the redemption rates of these programs speak for themselves. It's so often in public health interventions, we don't know what the impact or the use of the intervention is. And I mean, 99.9, that's an unheard
Yeah,
of sort of redemption rate.
yeah.
But, 97% for the East Harlem Vouchers program, and Groceries to Go is nearly 90% as well, which is, well above sort of what we typically see. So
I
phenomenal.
Yeah, if I can say, I think a lot of that too is the relationship time that we take. We really take all the programs, take the time to meet with the families, speak with the families, work with them, build trust. And here in East Harlem, there have been times, of course, with this federal government that there's a lot of fear, and they have fear of coming to our offices. But because they build trust and because we know them and we're able to communicate with them, be flexible about where we meet them, how they can come and get the vouchers, then they see that. That's why we're able to have that redemption rate. There's that trust that we build and that communication that we have to be able to do that. And all three programs had to have that. They had the time to actually speak with the families and address some of that fear so that they can do that and they can have this high redemption rate.
And you spoke a little bit about funders, and I'll say that, different philanthropic organizations have different slants on like what they like to support. I think there's a public understanding that people want a lot of the money to go directly to, um, you know, in this kind of program, like the participants, right? Low income foreign-born New Yorkers. We at NYHealth, we actually end up funding a lot of staff time across the board that we're a different funder for a variety of reasons. We don't focus as much as like on penetration rate or whatever, however people are framing that. But I think you and Adama both made this point that even though the vast majority of resources are going directly towards people participating, that you still need to fund personnel time because that is probably the difference in connecting them to other resources that those families don't need, that people don't just need money for food, they may need money for housing or access to jobs or whatnot. And so what a great opportunity to be able to, through these programs, also connect them to the larger supports that we have.
Exactly. Both are needed, right? We need the funding to have either the vouchers or to provide the credits, that actual service that's needed. We need that funding, but we also need the staff to be able to do this, to meet with the clients, to understand their situation, to be able to help them further. Because as soon as it's not just food insecurity means there's other issues they have. There's other income issues they have, right? So you can't just do food and then you're done. It's a whole person that we're trying to help here. So how do we do that help? How do we address that? So you need the funding on both sides. And yeah, Julia, when we were working with you and came with you, that aspect of like there's no limitation on the staff was great because usually that is a limitation. So it's like, great, we need the funding to be able to have the vouchers to distribute, but we also have staff that we need to be doing this on the ground and being able to do both. So yeah, that's the budget that we need for all these programs actually. Adam, I'm not sure if you had anything.
Yeah, I was going to pass to Adama. So Adama, if you want to jump in, go ahead, and then I'll ask you some additional questions.
I mean, staff was a huge issue for us. And what we had to do is when you're doing work on the ground, you learn to pivot. We actually get our volunteers for an NYC service, which has been powerful. We also get a lot of high school students and a lot of folks who are learning ELL, English as a second language. And the reason why we put them in a food pantry because a lot of our residents speak English. So it's a way for you to engage with them and learn how to say pineapple in English or in the different languages that folks are coming. But staff is so important, especially at a time like this, and being able to hire folks to run. So we use an app called Plentiful to record the data to prove that, listen, we're doing the work, look at the numbers, but we use Plentiful. And to hire someone to just stand there and take everyone's information, it's so harmful. But we have to use high school students who are leaving us at the end of the month. But I have to figure out what is the next step. NYC services is great, but it's based on when they are available. So staff is so important. And I think also space. Space is so important because we run our food pantry outside of DOE, so we really can't store our food inside. They're literally allowing us to do the food in the community because we can. Our other location in the Bronx is in a mosque, which is not, it doesn't have enough space for us to store food. So how our model works is once we get the food, we have to give it out to community. But even having a community space where I have a refrigerator, where I can have that 24-hour model or the 5 to 9 p.m. to service the community that work the 9 to 5, it helps a lot and it makes a huge difference. Like, I don't know if I should be sharing this, but sometimes I store stuff in my car and I'll wait for the residents to get off work. And I'm like, I'll meet you at the 103rd train station. I'm from East Harlem, so I grew up here. So a lot of the residents actually know me. They're like, oh, I know you before you wore that headscarf, Adama. I want extra onions. And I'm like, okay. But it's really like, this is your community. You like, okay, I'll meet you at the Hope Community Center. I'll meet you here. And I have your bag of foods. But I only do that for specific families, so don't advertise that.
Yeah, you might be regretting that. Adama, from what Carmita said, I'm curious, like looking through the report, are there supports? You talked about staffing, you talked about space. Are there other supports that you think are needed to serve immigrant communities right now? And what would you like to see more of at the city, the state, or the federal level?
Language access. I keep bringing it up because we keep getting excluded. Part of the reason why Afrikana started is because I was welcoming all the buses at Port Authority. I saw how our brothers from the Latinx community was treated. They got everything, but Black immigrants got nothing. And it was a lot of advocacy and push. And for folks that are coming from Africa, we immediately say French. And I have to remind them that we are colonized by the French, but our languages have survived. Like I speak Pulad, which is spoken all over Africa, but I speak Pulad from Guinea. In our food pantry, we have literally every language there. I only speak two, but there are team members who speak more than one language, and we're intentional about that. And I think it's so important to have language access because you can't tell me about food if you don't understand me. And then you'll understand, if you also have the language access, you'll understand this community won't eat this, but they'll definitely eat this. So I keep saying it, but we have to expand languages for the Black community. We cannot just rely on French. French is spoken, I think, in like 12 different countries. And if you're giving me Caribbean French versus French from France, it's very different. So language access is the biggest piece I would ask for.
Mm.
Thanks so much for that. So Kate, turning to you, the Carmita's report demonstrated the city is continuing to take steps to ensure that New Yorkers have access to food. Are there additional programs or resources that we should be aware of and sharing right now?
First of all, this is just so good. I thank you, Adama, language access. I think that cannot be stated enough. I also just need to like put a exclamation point around Carmita, what you said around choice. It's just so essential. And I think that that's a thread that is going to connect a lot of things on this webinar. Yes, let's talk. I think can't state enough right now the 718 SNAP now number. And that is because for those on the call who are connected with or individuals who are receiving SNAP, specifically who think that they are either facing work requirements or who might still be exempted from work requirements, just call that number to see if they still might be able to be exempted from work requirements. There's always, I'm going to channel Scott French, like, let's figure out if there's a way to be exempted. So that's 718 SNAP now. Also, just, don't get that confused with accessnyc.gov. That's just to figure out what benefits that you might be eligible for or what New Yorkers might be eligible for. So those are the two sort of like in the lane of DSS. So again, 718 SNAP now is for like, help me with my SNAP work that I know I'm eligible for, that I know I have, and I just have a question about my current SNAP situation. Access NYC is like, what benefits might I be eligible for? So yes, Julie, you mentioned NYC has, and I love that we're pointing out and focusing on the long history we have of supporting New Yorkers in putting food on the table with a variety of food affordability programming that helps all New Yorkers stretch their dollars and get the groceries that they need. The farmers markets, all different kinds of farmers markets have just many cut their ribbons in the last few weeks to open up the season. So let's remind people about Health Bucks. I think that we are going to see some new funding for Health Bucks in the upcoming budget. Just to remind people, those are $2 coupons that can be used to purchase locally grown fruits and vegetables at all New York City farmers markets and farm stands. If you use SNAP at farmers markets that accept EBT, you can receive a match of up to $10 a day that can stretch those dollars and pay for local produce. They're also distributed by community and faith-based organizations throughout the city, and they can be distributed to folks that also don't receive SNAP. They also have a wildly high redemption rate, speaking of redemption rates. There are similar incentive programs at over 20 participating grocery stores throughout the city called Get the Good Stuff, these are like the suite of incentive programs. They provide up to $10 a day for SNAP recipients to buy fruits, vegetables, and beans. And again, not just fresh, those could be frozen and canned as well. And as you may have seen in the report that Carmita described, NYC Care members, again, may be eligible for groceries to go, which provides, we heard a lot about this, credits. And I think that's probably why that has a lower redemption rate because it's not physical. Again, they're online credits. They may be eligible for groceries to go, which gets those credits for delivery or pickup with a 50% discount on fresh fruits and vegetables. And let's put the first plug in, and we're going to get this in the chat for summer food. NYC public school students, any kid actually under age 18 and under can receive free breakfast and lunch at school in the summer. So we've got another 26 days, I think, of school in session. Always breakfast and lunch is free, but free summer meals are going to be available when school is out of session for any kid under 18 and under, starting June 29th through September 4th. Also, just flagging once again, those more than 700 food pantries that the city sponsors through Community Food Connection. You can find out where those are through foodhelp.nyc to find the nearest provider and receive free food. If you don't follow any of the social through food policy, PEU, the city's public engagement unit, has done some really good social about the boroughs that and where you can find those food pantries. They're doing a really, really good job at that. And finally, while this is not a city resource, we want to ensure that everyone is aware that Medicaid recipients that meet certain criteria may be eligible for some really significant food as medicine support as a part of the 1115 waiver. And you can get connected to that via the social care networks of Public Health Solutions, SOMOS, or Staten Island Preferred Provider System by calling 311 or visiting nyc.gov/311. And as always, New York City encourages all residents to know your rights. The Mayor's Office of Immigrant Affairs is available to support all New Yorkers, regardless of immigration status. You can visit nyc.gov/knowyourrights for more information and resources. So I'm going to drop a bunch of stuff in the chat if it's not there already on all of these things. And I know that Julia and the Health Foundation will get those out in the after recap as well.
Thanks so much, Kate. That's so many programs and a good reminder to hear them all together. The last question we always end with from me, and I would still encourage everyone else to please put their questions in the chat. We have a couple and we'd love some more. The last question from me is, people here care about this issue. They want to get involved. From each of you, what can they be doing now? Kate, since you're off mute, I'll start with you, unless you're busy in the chat and
try to find the links. Okay. Well, so I'm gonna put a bunch of links in the chat, but there's so many resources that, quite honestly, are underutilized. And so I ask everyone to really share these resources. It pains me that some of these programs that are widely accessible to people are not utilized. And I think, we can scratch our heads and get frustrated when things like this happen. But when there are some programs that are really available and we're not utilizing them to their fullest extent, that's when I feel like we need to do better about getting the word out. And that's not to I don't want to, I want to also lift up what has been a theme on this is it's a scary time for some people. And I'm not discounting that, but there are certain, times of day or certain programs that, can be more discreet than others, and finding those kinds of programs is possible. And so, I know that there are some organizations that do a really great job at home delivery or at different hours or at more culturally appropriate foods than others. And I really want to appreciate, Adama, a lot of the a lot of your comments also about religiously inclusive meals, and that this is not just a nice to have, but a must have. That is something that I know I learned a lot about specifically during the asylum seeker response, and that's carrying through everything and all of the food responses that we have, not food responses, but food and meals that we're serving throughout all city agencies, and we're making certain of that. So that's my ask, is to really make sure that the programs that we have are utilized, but also when there's room for improvement, we get that feedback and can improve with really good feedback from people about how to make those improvements happen.
Thanks so much, Kate. Adama, I'll pass to you. How can people get involved who care?
Because of the times that we're living at, we strictly take volunteers only from NYC services, because we need to protect the community that we serve. So I highly recommend people to get on that website, sign up, and get volunteers there. We do get volunteers through HRA, and if there's high school students, we get them through their school. And we do this intentional because of the community that we serve. And, you know, I don't put past ICE that they would pretend to be a volunteer just to get information and data. So I prefer volunteers to go through that route since it's a safe way. I mean, this is a perfect example of government and community advocates working together, right? We found a route where we trust government to screen these people and to send them our way. So that's the best way. And to echo what we're saying, I know I'm the face of advocating for language access, but I know my community also feels the same. And I think if we keep repeating that, someone will definitely be listening and change those policies. So thank you for having me.
Thank you. And Carmita, before we open it up to general questions.
Funding. I'm going to say funding. That's what we need. The food voucher program has been grant funded. Right now, we don't have grant funding. We want to be able to continue this program, and not only continue it where we are, but expand it to further than just East Harlem. And we want to be able to have organizations that are in the community that know their residents and can also do this program. I'm not sure if everybody saw, there was a comment from Kathy Nonas, who runs Meals for Good. She's the one that actually, that's the organization that started the paper vouchers. She's willing to help if you want to start this program in another organization. She is willing to help teach you how to do that. It's very easy to do. So funding for the existing programs for the the food voucher program, for Groceries to Go. Groceries to Go has a cap on the number of participants they can do throughout the year. How do we increase funding from at the city level to be able to even meet more participants in that program? And then, and if you're doing a program within your organization, let's work together to expand it, to learn from what we did in these programs so we can better serve and serve even more. So I'll start with funding and partnering to reach even more people in these hard times.
That's actually a great segue into one of the questions, and I think you've answered part of it, and Kate, maybe you can answer sort of the rest of it. Someone asked, what is the funding status for these programs? Have they been baselined, meaning like, are they part of the annual budget? Where do they stand right now, Kate?
So we are in June. Our city's adopted budget will be finalized by the end of the month. Some of these programs commitments have been made as early as the preliminary budget for the city's Community Food Connection program. An unprecedented commitment by the administration was made in January with a significant additional 30 plus million in the preliminary budget, which takes that program to roughly $53 million at baseline.
And that's the
emergency food program, which the previous baseline funding was about 23 million. So that's really significant. And we might, it might land even higher than that, depending on what the city council and administration land at. There's also some baseline funding. So baseline means like that it starts at that for the next year. Baseline funding for Get the Good Stuff, which had never happened before. That's really remarkable. We're hoping that Groceries to Go gets funding. That is as a fingers crossed moment. Similarly, we believe that Health Bucks typically gets funded at adopted budget. That fingers crossed will happen again. What am I not mentioning? I think those are the sort of suite of sort of nutrition and food security programs right now. But thank you to everyone on the call who has pushed for these programs. We always need even more support. And again, especially in these dark moments when The federal government is slashing left and right. Nutrition education was decimated at the federal level, decimated. And many organizations are really not clear what's going to happen to them to locally with regard to that. But and again, I think the hardest part here, just coming from where this started, are the cuts to the SNAP program. We're really proud of the efforts that we've been able to make, but to be clear, many people are still suffering. So we're far from in a good place.
And Kate, since I have you, a program that we've talked a lot about that I'm really excited and I feel like is very early, so hasn't quite hit the news cycle, I guess, yet,
Yeah.
but is very promising is Pantry Link. And can you
Yeah.
describe sort of what your office has conceived there and what that could look like?
Yeah. So that's the thread that you're bringing in here from that Carmita mentioned, and really inspired the work that Kathy did with Meals for Good, right? Like this is I believe that we will have an announcement in July after a very well responded to RFP for Pantry Link, which is to a pilot city monies into a voucher program for emergency food. I can't remember how many responses we had, but it was, I believe, in excess of 10 to start to create a program that would, essentially, create a voucher program that would, take, I think, upwards of $1 million of our existing, city tax levy monies and start to experiment with what does it look like to have that through line of choice and begin to say, here's a voucher, you buy what you need in a grocery store. So we're creating that virtuous cycle of generating local economic activity, not having to, deal with receiving shipments of food at a food pantry who then needs to rely on volunteers to unpack, to redistribute, and learn from that, right? We've heard the great lessons. You've just seen a program evaluation of what that can look like and the benefits of it. And so the program's going to be built over the summer, should, people should be able to utilize those vouchers, hopefully in the fall to winter time, and we'll learn from that. That's to me a great sort of like, evolution of the emergency food system.
I'm so excited about that program, and to my knowledge, I feel like New York is the first place in the country that's experimenting with using emergency food dollars to provide benefits on cards. And it combines like a lot of the best practices that Carmita was talking about as I understand it, like the pantry providers will still be the touch points,
Yeah.
handing out those benefits
Yeah.
to people they know, like Adama was describing in their
it's always a
community.
both and, I just want to be clear. It's a both and. We have and we are, I think, again, the only city in the country that uses its own tax base for emergency food. And this is a small piece of that pie that's for this voucher program. And we are still, buying food to distribute as well. And so we're experimenting with this, but it's clear that, people value that. And it's clear that at a time when our retailers are suffering left and right too, this can really be a benefit to them as well. So, feed two birds with one seed, as a dear friend once said.
Thanks so much, Kate. Carmita, there's a couple questions for you in the chat. Based on the evaluation that you, and I should mention Christina, who is also on the call but not on screen, completed, which of these programs do you think could be scaled within New York City or in other localities most easily? Or is it one particular program, or is it aspects of those? And then also probably relatedly, given that there's a lot of excitement in the chat about that, can we connect some of those people with you directly if they'd like to discuss?
I think it's the response Kate just said. It's a both and. It's not one program that can do it. It's a both and. It's how to uh, if you look at groceries to go and the way they're able to reach because of the technology, they're able to reach a lot of individuals with the technology. You can have one call center that connects with residents all over the city and then connect them to different grocery stores and pay for the delivery and all that of a state citywide. However, that doesn't work for everybody. There's some individuals are not going to be that great with technology. They don't have access to technology. There's fear, and they need to kind of know somebody and trust where they're going, what they're doing, and that could be the local aspect of what the food voucher program does, where you come to a location in your community, you know the community. You can be going and seeing Adama every day and saying, Adam, I trust her. She's giving me these vouchers. She's going to help me with something else. So you need that aspect of a program too, that is then working within that community, especially in this fear-based time right now, and also helping the local grocery stores that we know and that have the food that this community needs. So I think you have to look at what your specific community and take aspects of all these programs to see how do you build it something specifically for you. But I think it truly is a both and. And I'm sorry, you had a second question. Oh, I'll put my contact information. I think, can they reach out? Yes, they can.
Great.
Here you go.
All right. Before I close, any final thoughts or parting words that you're burning to share?
I
Well, I
think
want to go
I
ahead,
think
Adama.
I think for me, there's a lot of food program funding. I know for small orgs like myself, we can't qualify for that funding because there's such strict requirements in order to be registered with the city to get a food pantry. But if you see our lines and the impact that we do in the community, it's very holistic. It's very different because we take the time. Come Fridays, you'll see me singing and dancing. It's not a great voice, but like I'm singing and dancing with community members. But also, we don't, the model that we have, thanks for sharing access, for believing in us and saying, listen, drop off the food, we'll make sure it gets to community, is that trust. So I think we also have to revamp or remodel how food funding goes to orgs like myself who are doing the work.
Thanks so much. And thank you so much for speaking today, Adama, Carmita, and Kate. It's been really, really helpful, and I hope it's just the beginning of a conversation on how we continue to work to expand food access for foreign-born New Yorkers. Really just so thankful to have people like you in our city working on these issues. We're really lucky. With that, I'll say, thank you to the audience for joining. There will be a recap that will be shared tomorrow. Or the next day, within the next 2 days. It will be on our website and email with many of these links. So thanks again. Really appreciate it.
Thank you.
Thank you.